Thanks very much to everyone. I'm Sally Wood, Recognise and Rescue Sepsis Matron at Nottingham University Hospitals. Really great morning, thank you. It's a question for Chris around education. So I was interested, there was a point you made on the slide around that there isn't a huge amount of knowledge about the underlying disease required to sort of interpret the news too. And I'm just sort of interested, and my question really is there a lot of integration around use of judgment, clinical reasoning, the impact of electronic, etc., and how we sort of combine judgment with that to therefore use news too? Because my concern is that if we don't apply a lot of clinical judgment, the news to specificity is not so good. And I'm wondering, so in education, how much integration of those kind of things are in it?
Okay. Oh, it's working. I don't have to press a button at all. That's a really interesting question. And my answer is a bit of a hedge, I'm afraid. I think it's a balance. I think the benefit of using scores is it gives you an objective view of what's happening that is consistent and can be applied across everything. If you just rely on clinical judgment, then your decision will only be as good as the clinical judgment of the person who is making that decision. And actually, that is where mistakes get made and problems occur, isn't it? When we just rely on one person thinking, well, I should do this or I should do that, that's where problems occur. And I think John's talk was a really powerful illustration of that, actually. I think one of the things that doctors really struggle with is to use scoring systems and be objective and forget all the sort of clever things that we've learned and just say, if it's this number on the news score, that's what I do. And then you can have a conversation, you can make a decision about whether you need to escalate to level 2, level 3 care, for instance, whether you need actually to think about whether an escalation of care is appropriate in a given situation, but you've got to have some objectivity in it to start with. I think, yes, in a secondary care setting, you should use every bit of equipment that you can to try and support that decision making, but we must realise that actually in terms of numbers, most people are in environments where resources are limited or actually non-existent. So it will sometimes come down to the most basic things. And it's important to be empowered. It's important for people to feel empowered to make decisions and bring other people in based on what is the score and what is the objective answer. John, I don't know whether you wanted to expand on that as well, or...
No, I think you're correct there. I think one person making a decision, it's proven, it's incorrect, and I don't know that much about NICE guidelines and news too, but they seem to indicate the likelihood of sepsis or the possibility of sepsis. So I feel they should be getting used and should be aiding clinicians, doctors, and then escalating. It's happening too often to too many people like me.
Hi, good morning, and thank you to all the speakers. I just want to expand on the news too. My name is Christine Duffy. I'm ACP in primary care. I work in a GP practice, so I see a lot of patients in nursing homes. And for me, that is why it comes into its own. I've done a lot of training with the nursing homes that we look after and started integrating it with the Restore too. My only disappointment is the fact that it's not shared across all of the clinicians. For example, on one occasion, one of the nursing homes assessed a patient, they called 111, presented the news to, and they were told, what are you doing that for? You are not in a hospital. And they felt quite disappointed because I had empowered them. I'd explained why it's important to do the news score and how it will help them review and escalate if they're not getting a response as soon as they expected. So I'm hoping that with the education piece, that's going to get clinicians to appreciate that in nursing homes and in care homes, it's really important for people to be able to assess. And when they call you back and say, Mrs. Bloggs is deteriorating because.
Thank you. I think that's an excellent point, and you've made it really well. I completely share the disappointment that you must have felt, but I think, yeah, we're on a journey. We've still got some way to go, haven't we, I think, but making sure people have understanding through empowering them through education will only help to support that. I don't know.
I think if I could come on to that point, that's part of the work of the NAPHATSIP programme. So one of those key indicators around the non-acute is that by March of next year, we're hopeful that 60% of all care home settings within the country will be using deterioration management tools, whether that's Restore, Stop and Watch, significant care, or 7, etc. So they will be using them. What the key there is, from your point, is the joined up approach that we've all talked about as speakers this morning. It's absolutely crucial that we get integrated systems right at this point whilst they're still forming. So I think to be at the table early, to have those conversations is crucial. One of the key things that we've been doing within this region is a webinar series. So 3-part care home. So across a 3-month period, 3 webinars that train them in the use of the tools. But then equally between that first and second session that we have a community GP INP session that wraps around so that they get taught exactly the same that we would expect the care homes, so that they wrap around then to make those decisions around the care homes. Equally, I talked in my slides about ensuring escalation clinical pathways. So part of those ICS deterioration safety networks that are forming across the country now, it's their vision and sort of role and responsibility, if you like, to make sure that those pathways exist. So that where there are blockages and communication issues within the system, that they're unblocked quickly and at pace. And that's one of the key things that the patient safety collaboratives are doing across the country. So you'll see much more of this. And also all 15 collaboratives report into the EHCH programme nationally and the Ogen Well board. So we're flagging some of those concerns nationally around that joined up thinking. But I think your point is spot on. I couldn't agree more, actually.